Repetitive strain injury. Repetitive strain injury, RSI, is a potentially debilitating condition resulting from overusing the hands to perform a repetitive task, such as typing, clicking a mouse, or writing. Anyone who uses a computer regularly is at risk and should know about RSI. The upper limb R.S.I.s is those that are most commonly encountered. Unfortunately, most people are uninformed and do not understand what RSI is or how serious it can be. In simple medical terms, repetitive strain injury, RSI, is defined as a cumulative trauma disorder, C.T.D. They stem from prolonged repetitive, forceful, or awkward hand movements. The result is damage to muscles, tendons, and nerves of the neck, shoulder, forearm, and hand, which can cause pain, weakness, numbness, or impairment of motor control. There are no characteristic clinical signs in RSI. Due to the ambiguous nature of complaints, RSI is included in the chronic fatigue syndrome category of drugs. You may wonder how seemingly innocuous activities such as typing and clicking a mouse button could possibly be harmful. Fine hand movements are repeated hour after hour, day after day, thousands upon thousands of times. They eventually strain the muscles and tendons of the forearms, wrists, and fingers, causing microscopic tears. Injured muscles tend to contract, decreasing the range of motion necessary for stress-free work. The sheaths that cover delicate tendons run out of lubrication because they aren't given time to rest, so tendon and sheath chafe, resulting in pain. Due to this abrasion, tendons become inflamed, and begin to pinch neighboring nerves. This can result in numbness, tingling, or hypersensitivity to touch. Unless this cycle is interrupted, it repeats itself over and over, and a long-term, chronic problem results. Repetitive strain injury can affect more than just your hands and wrists. Poor posture can lead to severe neck and back injuries. Staring at a computer screen can lead to eye strain. Repetitive reaching for a mouse can lead to arm and neck strain as well as spinal asymmetry. RSI is not a specific medical diagnosis, but rather a family of disorders. Many people mistakenly equate RSI with carpal tunnel syndrome, even though CTS is only one particular form of RSI. One recent study even reported that frequent computer users are no more likely to develop CTS than non-computer users. Don't let this mislead you, though. Many other forms of RSI do come on as a result of frequent computer use. The three primary risk factors are poor posture, poor technique, and overuse. In addition to these, there are several other risk factors to be aware of. While they may not cause RSI on their own, they can increase your risk if you already possess one of the three primary risk factors. You may be at risk for developing an RSI if you have poor posture, poor technique, use a computer more than 2 to 4 hours a day, constant computer use, have a job that requires constant computer use, especially heavy input, and do not take frequent breaks, are loose-jointed, don't exercise regularly, work in a high-pressure environment, have arthritis, diabetes, or another serious medical condition, keep your fingernails long, have an unhealthy, stressful, or sedentary lifestyle, weigh more than you should, don't sleep well. What are the symptoms of RSI? The primary warning sign of RSI is pain in the upper extremities, fingers, palms, wrists, forearms, shoulders. The pain may be burning, aching, or shooting. It could be local, for example, fingertips, or diffuse, for example, the entire forearm. The pain will typically be increased after a long session of computer use. Keep in mind, you can have severe RSI without experiencing pain. The following checklist, adapted from Pasquarelli and Quilter, can help you determine whether you have RSI. 1. Fatigue or lack of endurance. 3. Tingling, numbness, or loss of sensation. Do you keep dropping things? 7. Lack of control or coordination. 8. Chronically cold hands. 9. Do you have heightened awareness? Just being slightly more aware of a body part can be a clue that something is wrong. 10. Do you have hypersensitivity? Sympathy pains? In addition to these symptoms, RSI can also lead to behavioral changes. You may not even be aware of these changes. For example, do you avoid using the injured hand? 2. Use your forearm, feet, or shoulder to open doors? Avoid wearing or buying certain kinds of clothing because it is too difficult to put them on? Change shopping habits because you can't carry as much as you once could? 5. Do you keep dropping things? 6. Do you find you can't chop food? 7. Are you not playing sports you once enjoyed? Do you have trouble hooking bras or putting on jewelry? Not wear bracelets because your wrists are tender? 9. Do you have trouble with keys or brushing teeth? 10. Do you feel overly protective of your hands? Repercussions of RSI. If you develop RSI, and do not take steps to correct the problem, there may be serious repercussions. When RSI was at its worst, one may be unable to open doors, prepare own food, do laundry, drive, write, type, and shake hands. You may be unable to type regularly. Many RSI sufferers complain of similar problems. In addition to limiting your day-to-day functionality, this decreased independence can cause a significant emotional burden. RSI can limit your ability to perform at work. Recent U.S. Supreme Court rulings do not view RSI as a disability, and hence, RSI is not covered under the Americans with Disabilities Act. Therefore, your employer may fire you if you are unable to perform your job because of your RSI. The prospect of changing, radically, in many cases, your profession is obviously a daunting thought. For students, most universities are willing to make accommodations, but lost productivity due to RSI could still delay your graduation 1 or 2 years. And once you graduate, your next employer may not be as accommodating. Who gets repetitive strain injuries? Anyone can get a repetitive strain injury. Some of the most common people affected include 1. Workers with physically demanding jobs. 2. Athletes. 3. Musicians. 4. People who sit at a desk or use a computer often. How common are repetitive strain injuries? Repetitive strain injuries are very common. They lead to many conditions, including tendonitis, carpal tunnel syndrome, tennis elbow, trigger finger and trigger thumb, Osgood-Schlatter disease, back strains and sprains, shin splints. How does a repetitive strain injury affect my body? The most obvious way a repetitive strain injury will affect you is the pain, discomfort and other symptoms you feel. Because these injuries build up over time, that slow repeated damage can also lead to other conditions, including stress fractures, ganglion cysts, nerve compression syndromes, herniated discs, bursitis, Dupuytren's contracture. Repetitive motion injury symptoms. Tendonitis. The most common symptom associated with tendonitis is pain over the site involved. Tendonitis is made worse by active motion of the inflamed tendon. The skin overlying the inflamed tendon may be red and warm to the touch. Biceps. The painful spot is usually in the groove where the arm meets the shoulder. You can reproduce the pain by flexing your elbow at 90 and trying to turn your hand palm up, called supination, against resistance. Tennis elbow. This pain is in the lateral elbow and is reproduced by cocking your wrist back, extending the wrist, as if you were bringing a tennis racket back to hit the ball. Golfer's elbow. This pain occurs in the medial elbow but is made worse by flexing the wrist forward as if you were hitting a golf ball. Rotator cuff. Raising your arm out to the side reproduces this pain. The painful area is usually over the affected shoulder. Bursitis. Common symptoms include pain, tenderness, and decreased range of motion over affected area. Redness, swelling, and a crunchy feeling when the joint is moved, crepitus, may also occur. Knee. This condition involves swelling over the bottom part of the kneecap that is red and warm to the touch. Usually, the range of motion of the knee will be less because of the pain that bending and straightening the knee causes. Elbow. Pain, swelling, and redness are found over the elbow. The pain gets worse when you flex and extend your arm at the elbow. Hip. Your pain is increased by walking or by lying on the affected side. Bringing your leg away from and toward the midline of the body can also reproduce the pain. What causes repetitive strain injuries? Any motion or activity that you frequently repeat can cause a repeated strain injury. They happen after your body experiences the same kind of stress and strain over time. Common causes include 1. Working out too hard without warming up and cooling down. 2. Sports or other activities that require you to use the same motion repeatedly. 3. Poor posture when sitting or standing. 4. Working with a tool that vibrates. 5. Working in the cold. Diagnosis of RSI. A doctor will normally be able to diagnose an RSI through a physical examination and by asking questions. Doctor will ask about the sort of repetitious tasks the patient does regularly, what causes the discomfort, and when it tends to happen. There are two broad types of RSI. The two main groups of disorders are localized and diffuse RSI. Type 1 RSI is a musculoskeletal disorder. Symptoms usually include swelling and inflammation of specific muscles or tendons. Tenosynovitis, carpal tunnel syndrome and epicondylitis, tennis elbow and golfer's elbow. Type 2 RSI. Type 2 RSI has a range of causes. It is often related to nerve damage resulting from work activities. They include poorly localized or diffuse patterns of pain. There is tenderness and loss of function in the upper limb. What tests are done to diagnose repetitive strain injuries? It depends on what's causing your symptoms, and where in your body you're experiencing pain. Your doctor might need a few imaging tests to diagnose a condition caused by repetitive strain, including X-rays, magnetic resonance imaging, MRI, a CT, computed tomography, scan, an ultrasound. Treatment of RSI. The causes and symptoms of RSIs are varied, so treatment also varies. Types of treatment that are commonly used include medication, anti-inflammatory painkillers, such as aspirin or ibuprofen, muscle relaxants, and antidepressants may help. Sleeping tablets may be suitable, if sleeping is affected. Heat or cold, applying heat packs or ice packs. Avoid excessive heat or applying ice directly to the skin, as these can burn. Splints, some people use an elastic support or splint. Physical therapy, this includes exercises, manual therapy, bracing or splinting, and advice on adapting activities to cope with tasks or reduce the risk of worsening the injury. Steroid injections, these are only advised if there is inflammation associated with a specific medical condition, as they can have adverse effects. Surgery, as a last resort, surgery can correct problems with specific tendons and nerves. Prevention of RSI. It can be difficult to prevent an RSI from developing or worsening if the cause is related to work or other necessary activities. Repeated actions such as lifting boxes or painting a ceiling can lead to pain in parts of the body that are used excessively. The main way to reduce the risk is to stop or reduce the intensity of the activity. If the activity cannot be stopped, tips for reducing the risk include taking breaks. Taking regular breaks from a repetitive task can help. An alarm can act as a reminder to take short breaks. Stand up. Standing up and stretching frequently can reduce the risk. Extend the back, arms, and fingers. Eye break. Rest the eye muscles by looking up and staring for a moment at objects in the distance. General health. Eat healthfully and get regular exercise to keep your body resilient, and avoid smoking, as this reduces blood flow. Guidelines for computer and desk workers. The most common cause of an RSI nowadays is using a computer or sitting at a desk. The following guidelines may help prevent the most common complaints. Ergonomics. Ensure that the desk, chair and screen are aligned in an ergonomic fashion. Employers will have access to official guidelines. Posture. To avoid slouching, keep the ears and back in a straight line with the pelvis. Wrists. Avoid bending the wrists, and keep the arms, wrists, and fingers aligned when typing. Typing. Avoid hitting the keys too hard while typing. Touch typing can help, as each finger will take its fair share of pressure, and there is no need to keep looking down at the keyboard. Voice-activated software can also minimize typing. Shortcuts. Keyboard shortcuts can reduce typing and mouse movements. Mouse. Do not grip too tightly, and slow your speed to reduce muscle tension in the hand. Temperature. Ensure you are working in an appropriate temperature. Telephone. For those who need to type while using a telephone, wearing a headset is better than clamping the receiver between the head and the shoulder. Examples of R.S.I.s. Here are a few of the many conditions that are linked to RSI, although these conditions may also stem from other causes. Bursitis, the fluid-filled sac near a knee, elbow, or shoulder joint becomes inflamed and swollen. Tendinitis, a tendon becomes inflamed. Tendinosis, cellular degeneration of collagen results within the tendons, due to overuse. This is different from tendinitis. Carpal tunnel syndrome, painful compression of a nerve as it passes across the front of the wrist. Raynaud's disease, blood vessels in the extremities constrict when cold or stressed. It can be triggered by work involving vibration, such as using a jackhammer. Cubital tunnel syndrome, this can result from repeated or prolonged pressure on the nerve in the funny bone area, or from stretching this nerve for long periods of time. De Quervain syndrome, this painful condition affects the tendons on the thumb side of the wrist, and it is often associated with overuse of the wrist. Thoracic outlet syndrome, blood vessels or nerves become trapped between the collarbone and first rib. It mostly affects people whose job involves heavy usage of the upper extremities against resistance. Intersection syndrome, a painful inflammation of specific muscles in the forearm, caused by repeated flexion and extension of the wrist. It often affects weightlifters, rowers, racket sport players, horseback riders, and skiers. Dupuytren's contracture, a thickening of deep tissue in the palm of the hand and fingers can lead to permanently bent fingers. Using vibrating tools increases the risk. Rotator cuff syndrome, damage to any of the tendons that hold the shoulder joint in place. It is common in work that involves prolonged overhead activity. Medial epicondylitis, or golfer's elbow, this affects the inside of the lower arm, near the elbow. Frequently playing certain sports or repetitive twisting motions can lead to this condition. Tennis elbow. Lateral epicondylitis, or tennis elbow, this affects the outer part of the elbow. Stenosing tenosynovitis, or trigger finger, a finger becomes stuck in the bent position and, when straightened, it does so with a snap. This is also known as texting tendinitis. It may result from repeated, strong gripping. Radial tunnel syndrome, there is a dull ache at the top of the forearm. Overuse of the arm to push or pull or overuse of the hand and wrist can irritate the nerve and cause pain. Writer's cramp, muscle spasm occurs in the hands and arms, due to overuse. To sum up tips for preventing RSI. If you sit at a desk, follow the traditional advice from parents and teachers, sit up straight and don't slouch. Good posture is the key to avoiding unnecessary stress on your muscles. Adjust your workstation to promote good posture and comfort. Sit in a chair that gives you support for your lower back and keep your feet flat on the floor or on a footrest. Your thighs should be parallel to the ground, and your hands, wrists, and forearms should be aligned. Your elbows should be in line with your keyboard to avoid strain. Avoid sitting cross-legged. If possible, spend some of your computer time at a standing desk. Slowly increase the amount of time you stand, aiming for 20 to 30 minutes each hour or more. Place your computer monitor about an arm's length away from you. The screen should be at eye level so you're looking straight ahead. Taking frequent breaks from your desk throughout the day is as important as having an ergonomic workstation. Get up to stretch or walk around, do shoulder stretches at your desk, march in place, wiggle your fingers and flex your wrists. Those may sound like little things, but many breaks can make a big difference in preventing RSI. If you have to stand a lot, use an anti-fatigue mat. Use extension poles for cleaning tools to avoid straining your arms, and lift heavy loads properly. If you use tools, take breaks throughout the day to stretch and flex your fingers and wrists. R.S.I.s have been with us for centuries and they are unlikely to go away. However, learning more about what causes them and how to treat them can help us reduce the inconvenience and discomfort they can bring.